Hi, everyone. Welcome to this information session. We are going to wait a couple more minutes in case more people want to come on. So yeah, we'll just give it a couple more minutes. All right, we're going to go ahead and start, everyone. Hello, welcome, good afternoon. This is the information session on the Vaccine Uptake Initiative. I'm going to go over a couple of housekeeping stuff before we get started. If you have any questions, please send them to us in the chat box. We'll get to them as soon as we see them, as well as the webinar will be posted online after if you need it as a reference, okay? And we are going to go ahead and get into introductions. Hello, my name is Desiree Lapahi. I'm the data analyst from the National Indian Council on Aging. We also have Laura Sani here from the National Council of Urban Indian Health. Laura, would you like to introduce yourself?
Theo and Osta. Yes, my name is Laura Sani, and I'm a member of the Cherokee Nation in Oklahoma. And I'm the new Director of Technical Assistance at NCOA. I'm excited to be here and for you guys to join and talk about this excellent opportunity to increase our vaccination in our elders and disabled populations. We can go ahead. Yep. All right. So what we're talking about today is strengthening vaccine efforts in Indian country. As I said, to increase that vaccine uptake in our elder and disabled populations. Next slide. And so a little bit about NCOA. The National Council of Urban Indian Health is the national nonprofit organization devoted to support and develop of quality, accessible, and culturally component health and public health services for American Indians and Alaska Natives living in urban settings. NCOA strives to improve the health of over 70% of American Indian and Alaska Natives that lives in urban areas, supported by quality, accessible healthcare centers. Next slide, please. And then what is the definition of urban Indian? An American Indian or Alaska Native who lives in an urban or suburban area. Urban Indians may variously be permanent residents, including long-term residents, forced residents, or medium and short-term visitors, think like college, higher education, that type of thing. Approximately 78% AIANs live in metropolitan, urban, or suburban areas. Specific issues can include migration, identity, intertribal, pan-Indian perspectives. Next slide. And this slide kind of just summarizes kind of how the three entities that provide an Indian health system work together. You have your Indian Health Service, which federally runs facilities, and then you have your tribal, which is contract or compact facilities, and then you have your urban Indian organizations, which are funded by IHS and are native health nonprofits. Next slide, please. And then I won't go into detail about this, but this slide just provides you some of the services that are provided by UIOs: important primary care, behavioral health services, traditional medicine, and social and community services. Next slide, please. And then just some quick facts about urban Indian organizations. There's about 2.18 million, that's the population of AIANs, people in UIO service areas. And then was established in 1976 by tribes who advocated for treaty health rights for off-reservation American Indians and Alaska Natives. And then more than 70% of the 5.6 million AIANs live in urban and suburban areas. And then there's 77 facilities, 41 UIOs in 22 states. Next slide, please. And then again, I won't go into detail on this. This can be a reference for you guys to look at later, but this is just a great visual on the UIO locations by IHS regions. Next slide. And then while we're here, the meat of the presentation here, this webinar, this informational webinar is, why get vaccinated? Next slide. So American Indian Alaska Natives have long suffered for higher health disparities, including impactful social determinants of health. And so you can see here with the poverty, medium household incomes, housing ownerships, post-secondary education, all contributing factors to the health and well-being of Indian country. And next slide, please. And then again, just reminding and taking a look at some of those disparities that are found within our communities, including the urban area communities. You can see some of these chronic diseases, and again, just some of the factors that contribute to AIANs to have a lowered mortality rate. And so, with vaccinations, we have a tool that can help us save and prevent illnesses within ourselves and our family members. Next slide. And then again, just as a reminder, I'm sure all of us have heard some of the stories and statistics, but American Indian and Alaska Natives face some of the harshest outcomes of COVID-19. Some communities lost their native language speakers due to COVID. Situations like this disconnects our communities with our culture, which furthers genocide. And then compared to white children, American Indian and Alaska Native children were 4.5 times more likely to lose a parent or grandparent caregiver. One of every 168 American Indian or Alaska Native children. So again, you can see some of these statistics as reminders of how COVID-19 was devastating to American Indians and Alaska Natives. And so again, with this initiative, we're championing and trying to increase the utilization and uptake of vaccinations. And so this is just a great reminder of that. We have some tools out there that to get yourself vaccinated and to help your community members and your family members get vaccinated, because it can save lives. Next slide. And I will pass it back over.
Thank you, Laura, for that amazing overview of why it's important to get vaccinated. But now let's talk about the vaccine uptake funding opportunity. And we also have with us Susan Stiles from the National Council on Aging here with us as well. So the National Council on Aging is distributing millions of dollars in grants to qualified organizations working to increase older adults and people with disabilities to get the latest COVID and flu vaccines. NCOA will award grants for 6 and 12-month projects. The due date is March 1st, 2023, and there are a couple of tier-based awards. Now, for most of this, I'm going to stop sharing really quick while I go to a different document that we'll be referencing. Okay, can everyone see my screen okay?
Yes.
All right, thank you. So this is the funding opportunity description. We will be reviewing this because since this initially came out, there have been some changes that we will see in red and highlighted in yellow. So as stated, they'll be awarded grants for 6 and 12-month projects. The due date is March 1st, 2023. You will be submitting this using NCOA's application portal, and we'll have a little demo of that later on in the session just to review the application portal if you're not familiar with it. So the tier-based awards, let me go ahead and zoom in on this. It's the tier-based awards. So tier 1 awards are also known as community action grants, will support specific county, city, or other jurisdictional locales for a more targeted approach to vaccination efforts than tier 2. An organization may request grants with a minimum of $50,000 and a maximum of $150,000. And again, that's tier 1. For tier 2 awards, this is known as the regional collaborative grants. This will support statewide and territory coverage, regional or across state lines, if applicable. So those are the tier-based awards. Let's move on to the target population. For either tier, the focus will be reaching older adults and people with disabilities from underserved communities, including English language learners, homebound, Black, Hispanic, Latino, urban and rural Indigenous and Native American persons, Asian Americans and Pacific Islanders. You can read more about the rest of the targeted populations and here. Okay, so let's go on to eligible activities. And just a quick check-in. Does anyone have any questions so far? Okay. Nothing in the chat box. All right, so these are a list of eligible activities. Qualifying organizations, agencies may apply for funding using one or more of the following eligible activities. So just to name a couple, host community COVID-19 and influenza vaccination clinics, provide in-home vaccinations, disseminate credible information about COVID-19 and vaccines, and direct older adults and those with disabilities with questions to additional supports of information. And I'll just leave this up if you would like to take a couple of minutes to read some of the different types of activities. And I see we have, yes. So you can follow along. Becky Morgan shared the document here in the chat box. So those are a list of eligible activities for the grant. And then vaccines will be counted by collecting data via required surveys. I believe they have documentation provided by NCOA about collecting the surveys. So you can also look to their website for more information about that, or we could drop it in the chat box as we go on. Okay. These are some of the required activities for the funding. Educate and train community outreach workers, track and monitor vaccination and social service referrals, and vaccinate older adults and or people with disabilities. Okay, now let's go ahead and get into eligibility information. So some of the programs or the organizations that are eligible are senior centers, community centers, local community organization, government agencies, faith-based organization that serves, supports, and includes older adults and people with disabilities. And then this is a quick notes if you are from an area if you're an area agencies on aging or any of these other organizations, you can apply under a different call for proposals. And if you'd like more information about this, you can go ahead and check NCOA website for more information. So let's move on to how to apply. Organizations wishing to apply will submit a notice of intent to NCOA's application portal. The notice is non-binding and does not need to describe the proposed project. The application. So applicants must submit an electronic proposal describing the project and the applicant with background relevant to the issues outlined in these guidelines. This proposal must include the following items: a statement of need, target area and populations, as well as an ACH form. Okay. And then here's some more information about required documentation. We will go ahead and move on. And then we'll go ahead and talk about the application review. So applications will be scored based on a maximum of 100 points across the desired review criteria, and an additional 5 points will be awarded for inclusion of key partners. So we have the statement of need, which would be 10 points, target area and population, 20 points. As well as description of approach, 30 points. Have your data collection and evaluation, 15 points. Management and organizational agency capacity, diversion, equity, and inclusion. And those are all the criteria for the application.
Desiree, I just wanted to note that there's a question. Would federally recognized Indian tribes be eligible for Tier 1 or Tier 2? And it looks like Ms. Stiles is helping answer that.
Okay. Okay.
Yeah, I'll just instead of typing it, I'll just answer it.
Yeah, please.
Like this. So you would be eligible for either one. It's going to depend on the size of the kind of the footprint that you would be proposing to work in. And if it's a smaller footprint, then we would recommend that you propose a Tier 1. And if it's a larger footprint in a multi-county or city or regional area, then you might consider applying for a Tier 2. But you would be eligible for either.
All right, thank you, Susan. Susan, is there anything else you'd like to add to?
The only other thing I would add, and you kind of highlighted it as you were going by, but it's a big change in the actual financial documentation that we're asking for now. So we heard from a lot of different organizations that some of the financial documentation it wasn't going to be something that they could provide. So for a tier one, if you're applying for a tier one grant, providing either a 990 or a 990 EZ form is, both of those are acceptable. And also, if you do not have a financial audit, and many small organizations don't have a financial audit, you can apply for, or you can, let us know that and apply kind of for a waiver, for, to the effect that you don't have an audit for, X, Y, and Z different reason. And then similarly, for tier two applications, we do want to see an audit for those larger organizations and those larger efforts. But if you don't have an audit, then you can work with another organization that could be a sponsoring organization in submitting your grant to us. Or as it says here too, you can submit a completed review and attestation on internal controls, and a commitment to get a full audit. But these are all pretty big changes that we put in place based on feedback, again, that we were hearing from some applicants. So I hope this makes it a little bit easier to make that decision to apply.
All right, thank you, Susan. Let's go into the NCOA application portal. So let me switch out of this. So we'll go to, this is the homepage of the NCOA's uptake grant application. So we have the notice of intent here. We're going to open that. They have an eligibility quiz. And you can also save draft here. Or go back to homepage. So it's very simple. And you can, let me see, let me log out. And you can also email vaccineuptake@ncoa.org or visit their home or the FAQ section. So yeah, and this is one of NCOA's webpage where you can also learn even more information about it, as well as go to the application portal here. I believe there's, okay, we have another question. Can awardees utilize funding to purchase a vehicle for transporting clients?
And unfortunately, the answer is no to that. We did, a few organizations have asked the same question, and we talked to ACL about it, and we can't, under this type of a grant, allow for the purchase of a vehicle.
All right, thank you, Susan. Okay, let me stop sharing. Okay, so that concludes our information session. Are there any questions? Any other questions? We'll give it a couple of minutes.
I do. I have a few frequently asked questions that we've been getting from a lot of different applicants, so I can maybe go over.
Yeah, please.
Those. Okay, all right, because we have been getting a lot of application or questions in. As Desiree said, there is a FAQ page on our website that goes through a number of different questions, including that vehicle purchase question, because that has come up quite a bit. But But some of the other questions that we have gotten are actually, can I share my screen? I think that might be easiest here.
I think you should be able to.
Okay. Hold on, let me find. Just need to open up. Too many things open right now. One is there a minimum of number of vaccinations for? Oh, here it is. And required if funded under tier 1 and tier 2. So the answer to that is probably the minimum number, for tier 1 is probably about 500. So that's what we're kind of looking at as we're looking at these applications. But there isn't a set number of vaccinations that we're looking for based on the amount of funding that you're asking for. We're trying to really look at these applications really holistically and understand, the area that you're serving, the population, the transportation needs, etc. So we didn't want to assign a specific number of vaccinations to a specific funding amount. So I would say, ask for what you need. And based on your experience doing similar types of events or outreach, ask for that level of funding. Another question that's come in a lot is, can grant funding be used to cover the cost of vaccines, such as the flu vaccine or some vaccines for people who are uninsured? And right now, the answer from the federal government is no, but we are in, and we just had a meeting earlier today, we're in discussions with our program officer at ACL to dig a little deeper on this one, because we know that with the end of the federal emergency and with the even the COVID vaccines will be kind of taken care of more in the regular healthcare marketplace, in a lot of ways going forward, that this is going to be a topic that it needs to be addressed. So right now, the grant funding cannot be used to cover the cost of vaccines, but we are in discussions about that. Another is related to paying for contracted staff or any outside entities. And the answer here is yes, grant funding can be used to pay for contracted staff or outside entities. So if you're partnering with a local health department and there's a community health worker you can and that you need to contract with, and that might be an instance where you would want to include that in the budget. Marketing activities, yes, absolutely. The grant funding can be used to pay for marketing activities. And, you may already have some resources and outreach materials that you've been using and some events that you've already planned. So that would be a great use for these grant dollars. And we are going to also, from our side, be putting together some various toolkits that the grantees will be able to use to enhance their marketing activities. And also, probably, in the next 5 or 6 months, launching a little bit more of a national media campaign around vaccines, so that we can kind of, again, keep the information sort of at the forefront for older adults and people with disabilities. grant funding and incentives. So yes, grant funding can be used for incentives. And the only kind of catch here is that the incentives can only be as much as $25 per person. So that might be a gift card, a meal voucher, but it can only be up to $25 per person. Another question that we have gotten a lot is from organizations that have really more of an intergenerational focus. So while they serve a lot of older adults, it's really an intergenerational organization. And so we do want to encourage, those, if you are running something like an intergenerational vaccine clinic, then that absolutely is allowable under this grant. We would just ask that, the focus of your audience that you're serving is, an older adult or a person with a disability. But certainly if it's, there's an opportunity for the family to be more involved, for a younger person to bring an older adult or vice versa to a clinic, then that's great. The data collection piece, I think as Desiree noted, there is there will be a fair bit of data collection with this project, given kind of the visibility of this funding from the federal government. So we have partnered with US Aging, and we'll both be using the same platform to run kind of the data collection. And what's nice about this particular platform is that it allows for you to catalog kind of both events that you've held and talk generally about, the number of people who came and what type of event it was and how you did the marketing and outreach for it. But then also there's a way for you to be able to pretty easily use kind of an iPad or phone or computer to input information about the individuals who received a vaccination. So, it's a completely, anonymous survey, of course, and has some basic demographic questions in it. And then the final question here is, I think we already talked about this a little bit, is that financial documentation that's needed for the Tier 1 and the Tier 2 grants. So I'll stop sharing there. And
then can you go ahead and go over the eligible organizations in more detail, if you're able to, Susan?
yeah, I mean, what are some specific questions that you have, Rebecca?
Oh, I think it was just curious, as we wanted to encourage and make people aware that they might be eligible and not realize it. I think that we were saying that on another call, so to make sure we got the word out.
We do have a question in the chat. Would a home care agency be eligible?
If the home care agency is a nonprofit, then the answer is yes. But if it isn't a nonprofit, and I'll just pull this up again as reference, then it wouldn't, I don't think it would be eligible. The other federally recognized nonprofit organizations at the bottom, that's a big bucket. So we have had a couple of applications in from universities, for example. So that's a type of organization that you might not normally think of. applying for this kind of a grant. But really what the grants that we have as opposed to the US Aging, which is really serving, you know, the AAAs, the no wrong door systems, is the grants that NCOA has are more for those senior centers, community centers, the local, any local community-based organization, or faith-based organization. A government agency like a state health agency could apply, also, or city. So it's pretty, I think it's pretty broad, but the key really is that you're a nonprofit, and you're not an ADRC, you're not an AAA, you're not a no wrong door system, you're not a SIL, or that Center for Independent Living. But if you have a specific question, I mean, if you're wondering if your organization will pass that kind of eligibility criteria on our side, feel free to send that specific question to our help desk, that vaccineuptake.org address.
All right, thank you, Susan. We are 7 minutes over the 30-minute mark of the information session, but that's okay. So the deadline for the vaccine grant or funding opportunity is March 1st. You have to get your notice of intent in by then, correct?
Yeah, I mean, we would love to see applications by March 1st. Now, we don't, you know, we may be extending that, but really we'll be handing out the funding until we've expended it all. So, so we are doing this on a rolling basis, and we do anticipate a large number of applications next week. We've been getting quite a few applications in already, probably about 80 or more. So we have had quite a few applications.
All right, well, I think that's about it. I don't see any other questions in the chat box. Thank you everyone for joining us on this information session. Thank you, Susan. Thank you, Laura. And we hope to have you guys submit your applications. All right, have a good day, everyone.
Bye-bye.
Bye-bye.